When we work chiropractic with children, they clamber on the table to be the first ones to be adjusted. They improve in their overall digestion, they improve in their immune systems, they improve in their overall well-being, and this is what we want to have. Children that are healthy, happy, connected mentally, emotionally, physically. And when we get to that point, boy, what a great future we're going to have.
Absolutely. I mean, there's so many, but some of the ones in particular are always the cases of colic. We get the kids that obviously, when these children have colic, they're very upset and they're very uncomfortable, and the parents are just beside themselves. They're not sleeping. They fear and they don't like to see their child suffering. And so, once we return the brain-body connection, it's just amazing to see what happens and how these children just start to thrive and start to function the way that they were designed to, and it's just absolutely amazing. And the parents start to get some sleep, and obviously their concern goes away, and that's just so exciting.
My youngest patient was 30 hours old, and the parents brought him in because they were under chiropractic care and knew the importance of being adjusted early in life. And I think it makes a lot of sense when people understand the principle behind chiropractic care, and they can only benefit totally from chiropractic care. Their optimal health can only be expressed once their nerve system is free of interference, and that should be the goal of chiropractic care.
Chiropractic for kids really just makes sense. The nervous system controls everything, and the more parents... Sorry, this is distracting. I can come back later and do this.
The principle of chiropractic is that the body's innate recuperative powers are integrated, modulated, and affected through the nervous system. So what we're really looking at is optimizing the nervous system through the spine and through ancillary methods that we're going to be giving our patients. So the practice is actually involved establishing a diagnosis through doing a proper history and examination, and through that we provide care, and the care is primarily in the form of an adjustment and ancillary methods that are going to help people work through the process of their own body healing themselves. The basic tenet behind chiropractic is essentially that the nervous system is the master controlling system of the body. It integrates, it allows us to experience our world, and allows us to, when it's properly functioning, allows us the most appropriate choice at the moment to adapt to that environment. The practice of chiropractic, we are looking at science, we look at obviously our understanding of anatomy, physiology, biochemistry, and how the body interacts within itself, communicates within itself and its environment. And through that, we are looking at when we get disorders and dysfunctions, and that creates a dis-ease, a lack of ease within the body, or if you will, disease, if it's that past the point of breakdown, we actually can name it to something. Then what we're doing is we are establishing this diagnosis, and we're creating a chiropractic care plan on how do we get this body back in order. What is it going to take from the person as well as from the doctor? Vitalism is a traditional term that is really used that the body is more than the sum of its parts, and there is some form of cohesive life factor or life force, if you will, that allows this body to reconstruct and recreate itself according to universal law or universal principles. It's been called looking at humors, it's been looking at life force, looking at anything that causes this internal ability to recreate itself. It's a property of something that is more than the uniqueness of just a piece. Vitalism comes into all components. I mean, we're looking at it physically, mentally, spiritually. We're looking at it at every level. So chiropractic fits into vitalism primarily because we can look at the body as a whole, and we look at the body in case of the environment with respect to that environment. Rather than just treating the effect, what we're looking at is we're trying to take care of the whole person and get them to understand how they interact in their environment and what may need to change, and we coach them through that process. So that's much more of a vitalistic type of a perspective. One of the things that we look at, though, is we're looking at what's going on with dysfunction and lack of ease within the body prior to it breaking down to the point that it can't repair itself. And that's where we're fitting in, as sort of that mid-stage and early stage, earlier detection than perhaps what some medical practitioners can do, although there are some in the industry that are doing that as well. The evidence is showing that the parents that are actually taking children to chiropractors are actually higher educated, and the most common reasons is dissatisfaction with other treatment methods. And I think where chiropractic has an advantage is that we are spending the time with our patients and finding out what is the environment of this child and where are they not adapting in their environment. And then through very simple procedures that we do through an adjustment, how we can reestablish this normal biomechanical and neurological integrity of this child to allow them to adapt in a different way. And at the same time, we are looking at what's going on with this child's nutrition, what's going on with their physical activity, what's going on with their quantity of food, what's going on with their social development. On the first visit, really what you should be seeing is a detailed history. We're looking at consultation on how is this child fitting in with the family, what's the relationship like, what is the history of the child, the birthing process, the development, what are their behavioral issues. We're looking at really things chemically, physically, emotionally, spiritually for this child's development. And then obviously the particular, if there's a chief complaint, we're going to be going into detailing the chief complaint and what the expectations are through the parent. At the same time, that will be then followed by a detailed examination where we're going to be looking at things like the pediatric reflexes, ranges of motion, postures. We're going to be palpating for how the spine is actually functioning. We're going to be palpating for the musculature. We're going to be looking and really doing a lot of detailed observation. From there, a parent should then expect really a report of findings. What did we find? What is our plan of management? What do we want to do? When do we want to do it? What's the order of what we're going to do? And through that, of course, we have the diagnosis. And then there will be an eventual time where we say, let's reassess this child to see how they're coming along, which will dictate, do we need to change care? Do we need to do something in a different way, change the frequency? What are the outcomes? So really, and at the same time, we may be asking parents to start to look for things, different episodes in crying, or better sleep patterns, or better feeding patterns, or better bowel movements. So all these different kinds of things that can happen for why we would normally see children. Yes, we're seeing babies, and again, it's really just the knowledge that these problems don't start at some magical age of 18. We're seeing that a lot of these problems have started in early youth. And there is actually evidence now of degeneration in children's discs before they're out of their teens. So there's something going on in the way these children either are or are not active, and or their environment, could be nutrition, could be a lot of different things. But what we're really looking at is establishing a good neurological supply so that that body can comprehend and respond most appropriately in its environment throughout our age. And about 65% of neurological development after birth occurs in that first year of life. We're laying down new tracks, we're learning new things. And so how we lay these things down, and especially in critical periods, will dictate how other things can then grow on top of it, because it's all in layers. 90% of the synaptic connections have occurred by the time we're 6. And after that, it's now the pruning, it's the fine-tuning, it's the expansion on what we're actually experiencing in our environment. So you're going to see a number of different reasons and frequencies and reflections, because the care is reflected on the child. It's a reflection of the child's life. When I simply put it, it's the body being exposed to too much stress. And if you will, it's almost like it's overwhelmed, and that could be biochemical, so chemical stress, it could be emotional stress, it could be physical stress. Physical stress is not just the fall down the flight of stairs or the whiplash. It's the cumulative day in and day out, the position the child is in, the posture that they've assumed at school. So when the body gets overwhelmed, it's almost like it blows a fuse, and that becomes very protective. The problem is we don't always know when we've blown the fuse. So the causes of these fuses being blown can be physical, chemical, emotional, and they can be micro or they could be macro in nature. So an example for a physical trauma that's micro in nature is our posture. So you see the posture your kid is assuming day in and day out. That has a cumulative effect, and each day and each moment is like a drop in the bucket. Then all of a sudden the bucket overflows, and we have some sequelae that is associated with that. People seem to understand the macro traumas, the kid getting hit in hockey, or they're falling down a snowy slope, or they're tobogganing and they flip off their toboggan, or they jump off the diving board and they do a funny twist. We understand those. So there's a memory associated with all of this, and it's a memory that's within the body. So if it's beyond the body's ability to cope, it kind of blows a fuse. That's what we're looking for, is where those fuses are blown, to be able to reset them and let these children get into a different state, if you will. More information, you can certainly go to a number of sites. Specifically with children, what I really like is the International Chiropractic Association. You can click on to their pediatric section, their children's section. There's lots of resources there. Also the International Chiropractic Pediatric Association.
Yeah.
Okay.
Thank you.
Okay, stop.